In today's session, we are looking at Ascariasis, and the focus for this question will be the scenario for the June 2025. So we'll go straight to look at the scenario for today. The scenario reads, Mrs. Basil Chambwa, aged 45 years, has been admitted to the outpatient where you are allocated with abdominal pain, bloating, vomiting, and lethargic. Following thorough investigations, intestinal obstruction due to worm infestation has been made. She is scheduled for laparotomy. Question A says, mention the worm that causes ascariasis. B1, state any 5 predisposing factors to ascariasis. B2, mention 3 drugs used in treatment of ascariasis, indicating the name, dose, mode of action, 2 side effect, and nursing implications. Question C, explain the specific preoperative care you would give to Mrs. Chambwa on admission to the hospital. D, state 5 complications Mrs. Chambwa may experience post-operatively. So we'll go straight to question A. In case we are asked to define ascariasis, we can define ascariasis as this is a gastrointestinal tract. This is a parasitic gastrointestinal tract condition caused by Ascaris lumbricoides, affecting the small intestines, characterized by passage of worms in stool, loss of weight, and abdominal pain. So this is how we can define ascariasis when we are asked to define. Sometimes we may be asked to define acute abdomen, and we can still define acute abdomen as this refers to a sudden severe abdominal pain of unclear onset that is less than 24 hours in duration, characterized by severe abdominal pain, gagging, and abdominal distension. Now, going back to our question A, which says you mention the worm that causes ascariasis. Of course, you say ascariasis is caused by the worm known as Ascaris lumbricoides, and this is one of the largest nematodes which affects human beings. The females are larger, measuring between 20 to 35 centimeters in length, while the males are a bit smaller and they may measure between 15 to 30 centimeters. And of course, the other characteristic the Ascaris lumbricoides has is that it has a creamy white or pinkish elongated cylindrical body. So the question was for 5 marks, so it's not just listing the cause, but also attach the characteristic of this same worm, like in this particular case. Question B1 says 5 predisposing factors to ascariasis. The first one is poor sanitation. Where there is lack of access to proper toilets, it may lead to soil contamination because people will practice open defecation. And during rainy season, these feces will be washed into people's water or gardens and other things, and people may easily ingest eggs of ascariasis because of poor sanitation. Also, use of feces as fertilizer. This is because using night soil or feces as fertilizer can cause direct deposit of eggs into the soil, which end up contaminating the vegetables or the crops. And hence, use of night soil is a risk factor. Geographic location, of course, ascariasis thrives in conditions which are warm, moist, which are mostly warm and moist. And when you look at Africa, we experience both of these type of weathers. Hence, Africa in itself is a high risk for ascariasis because it provides a favorable environment for growth and development of this particular worm. Many other risk factors include poverty and overcrowding, of course. This is because where there's overcrowding, there's inadequate sanitation, limited access to clean water, poor personal hygiene. All these are seen where there is poverty or overcrowding. young age or children, and this is because children have when they reach a particular certain age, or if you look at the developmental milestones of a child, there's a phase refers to as the oral stage, where the child easily puts things or dirty things in the mouth. Whatever they see, they put in the mouth, and this may easily cause introduction of the eggs for ascariasis in the mouth of a child, because they are putting in dirty things. So those are the risk factors of ascariasis that we can discuss. Apart from that, of course, the next question B2 says the 3 drugs used in the treatment of ascariasis, and it said you mention at least all these things. One of the drug that we can give is albendazole, and the dosage is 400 milligrams, a single dose. The mode of action is that it inhibits microtubule synthesis in the worm. In other words, it results in paralysis, spastic paralysis of the worm. It has common side effects like abdominal pain or discomfort, headache, and dizziness as well. Some nursing implication you can discuss is, of course, you can advise the patient to administer the drug with food to reduce GI upset. Apart from that, advise the patient that dizziness may occur, and they may avoid, of course, driving or operating machinery if affected. The other drug that can be given is mebendazole, which is 100 milligrams twice a day for 3 days, or you can give 500 milligrams single dose orally as well. The mode of action, of course, it inhibits microtubule formation, hence causing death of the worm. It has common side effects like diarrhea, and rarely also irreversible hair loss may be seen. Some of the nursing implication is you can monitor signs of diarrhea and ensure hydration, and also make sure that the chewable tablets can be crushed or chewed. Let the patient chew it thoroughly, this particular tablet for mebendazole. And of course, the drug can still be taken with or without food. So most of the time we'll force the patients to take these drugs early in the morning after waking up, when the stomach is empty. We just want to promote effectiveness in its absorption. But for this one, even with food, it can still be taken. The third drug that can still be given is ivermectin, and ivermectin you can give 150 to 200 micrograms per kg body weight as a single dose. This drug causes paralysis of the worm. It has side effects like pruritus, skin rash, of course, also muscle-like reactions, which includes symptoms like fever, headache, dizziness, joint pain, all these symptoms occurring at once. One of the common nursing implication is that you always administer this drug on an empty stomach with a full glass of water after giving the drug, so that you promote absorption. Apart from that, observe for any sign of allergic reaction after administering the drug, so that corrective measures and interventions are given. So these are the drugs that we can give. The next question talked about preoperative care for Mrs. Chambwa on admission. Of course, the preoperative care talk about the introduction, talk about EMS. It's an emergency. So the specific pre-op that you're giving here is emergency pre-op. You're not giving elective, but emergency pre-op, because this worm has resulted in acute abdomen. Then you talk about patient resuscitation, airway, breathing, circulation, pain management. From there, talk about observations, investigations, psychological care, consent form, of course. Then you move on to the physical preparations, talk about the gastric preparation, bowel preparation, bladder preparation, local cytoskin preparation, removal of jewel or dentures, patient identification, pre-medication, gowning, transfer to theater, post-op bed, and of course communication to the family. So this is what you can talk about as a specific pre-op, which is emergency in nature. And these are the headings that you can talk about in terms of EMS, in terms of introduction, In terms of patient resuscitation, you talk about these points. Breathing, talk about at least these points. Circulation, you discuss these points as well. And of course, pain management. So these are the specific points that you can put on each particular heading. So psychological care, at least write some points that you can give, and make sure that you are talking about giving brief psychological care because the condition is an emergency. Consent form, just talk about the first point. Physical preparation, you discuss gastric preparation, just specific to the condition. Bowel preparation, of course, that's what you can talk about. Bladder preparation, this is what you can talk about. The local site or skin preparation, this is what you can talk about. Removal of jewelry, talk about patient identification, talk about, of course, pre-medication, talk about gowning, transfer of the patient to theater, and of course post-operative bed and communication with the family. So the specific pre-op that is being applied here is emergency. It's not just writing any of the pre-op, but be specific to the one that applies to the patient. The last question said 5 complications Mrs. Chambwa may experience post-operatively. Amongst the complications, one is surgical site infection. So the abdominal incision may become infected, where it presents, maybe it looks reddish, swelling, warm, pain, and there may be a purulent discharge. And this may occur because of maybe poor wound cleaning. Paralytic ileus is another complication that may be seen. And this is because the bowel movement may remain, the peristaltic movements may be absent rather, and this is because of maybe the effects of anesthetic drugs, or because of also just surgical complications that have happened during the surgical procedure. Hence, this even prolongs the hospital stay of the patient because it means that you will not be able to introduce normal feeds because there's still paralytic ileus. Deep vein thrombosis can occur because of the patient's immobility after the surgical procedure, and this increases formation of blood clots. Pneumonia may also occur, especially to patients postoperatively. They are bedridden, recovering from effects of anesthesia, hence they may easily suffer from hypostatic pneumonia. Anastomotic leak, of course, sometimes the segment of the bowel which is removed and the two ends which are joined, known as anastomosis, this connection may fail, causing leakage into the peritoneal cavity, resulting in a more serious complication, which is peritonitis. Evisceration as a complication may occur. Also, protrusion of abdominal organs through the surgical wound may occur as a complication as well. Pulmonary complications, we have talked about them. Dehiscency, where there is partial or complete separation of the surgical wound layers. All these may still occur. Deep vein thrombosis, we have talked about, to say it can also be a post-op complication. So at least choose any 5 of these post-operative complications and apply them. And that is how you could attempt this particular question for ascariasis slash, of course, acute abdomen. So till next time, that's all for today. Goodbye.